Al ingresar a la presente conferencia de la 10ª Feria Internacional, los participantes entienden y aceptan que sus datos personales e imagen podrán ser divulgados por la Universidad de Monterrey para los fines aquí descritos. La sesión será grabada y almacenada para conformar un repositorio que servirá para futura consulta y referencia de la Universidad de Monterrey, y también podrá ser difundida por la misma para fines administrativos y otros relacionados con la promoción y capacitación por parte de la universidad. El acceso al material y contenido del presente evento no implica una licencia gratuita para su uso, por lo que deberán respetarse en todo momento los derechos de autor. La información compartida no podrá ser transmitida, grabada ni divulgada en ninguna forma a ningún tercero. Las opiniones expresadas en esta sesión son responsabilidad de cada participante. Se solicita realizar este intercambio de ideas y opiniones con tolerancia y respeto.
Gracias. Buen día tengan todos ustedes. A nombre de la Universidad de Monterrey, les doy la más cordial bienvenida a esta decimoferia internacional UDEM, China 2020, en coordinación con la Escuela de Medicina. Soy la doctora Marta Martínez Guido, coordinadora del programa de medicina, y en esta ocasión tenemos la oportunidad de compartir el tema COVID-19, experiencia de Wuhan a México, la cual será presentada por el doctor Xin Shao, quien trabaja como jefe médico en el Hospital Tongxi de la Universidad de Ciencia y Tecnología de Guangzhou, universidad pública dedicada a investigación y ubicada en Wuhan, China. El Hospital Tongxi, ubicado en el epicentro de la pandemia, se ha especializado en el tratamiento de pacientes críticos con COVID-19. Junto a sus colegas, el doctor Xin Shao ha trabajado en la primera línea de atención por varios meses, en los que han atendido más de 32,000 pacientes en el pabellón de COVID y casi 2,300 pacientes en estado crítico por esta enfermedad. Basado en los diferentes consensos sobre tratamiento y administración en las áreas COVID-19, el doctor Xin Shao ha liderado e implementado estrategias para el tratamiento de los pacientes y para la seguridad del personal que brinda la atención médica. Cuenta también con importante experiencia en la atención médica virtual de pacientes COVID a través de la aplicación móvil del Hospital Tongxi, con 527 pacientes atendidos a distancia en los últimos 3 meses. Cuenta con formación médica especializada en oncología con importante experiencia en temas pulmonares, destacado con múltiples publicaciones científicas en esta rama y participación en conferencias internacionales. A continuación, daremos inicio a nuestra conferencia, la cual cuenta con traducción simultánea y podrán encontrar la opción en la barra del menú inferior con el icono Interpretación. Esperamos que la disfruten. Bienvenidos.
Welcome, Dr. Chao. Thank you for your participation, and then you're on. Thank you.
Okay. Can you hear me now?
Yes, we can hear you.
Okay. Thank you. Hello, everyone, and thank you. And it's a good night, and it's a good chance for me. It's a great honor to have the chance to share my feelings and experience during containing COVID-19 here. And I have this talk called COVID-19 Experience from Wuhan to Mexico. In 2020, this is an eventful year here. And we know Wuhan is a very common city. But from 2020 to the whole year, we have maybe the whole world knows what is Wuhan. Well, it's Wuhan. Okay, so in China, the epidemic this year changes a lot. And in the whole world, I think the COVID-19 changes or the whole world a lot. Some people lost their jobs. because of the limited transportation and lockdown of the city. They couldn't continue to afford the rent. And some people lost their communication with the others in labs, companies, and even some people lost their families. So after everything gradually goes back to normal without any worry about being infected, we Chinese people enjoyed our long holiday from October 1st. It's a long holiday, Chinese long holiday, which is the National Day, China National Day, and the Chinese Mid-Autumn Day in Wuhan, in Shanghai, from north to south. The crowd and the laughter in every scenic area shows that confidence to life is returning. And according to news, around 1 million people fly in Wuhan Tianhe Airport on September the 30th. They lined up to buy what they want. It seems the whole market will bounce back soon. And today, I want to share you, or I can't share you all the information about Wuhan. However, I think these 3 parts will be the most important. First of all, I want to show you what I have done and my feelings during this fight. As we know, respiratory transmitted viruses have invaded into our life many times. For doctors, we never gave up to study their molecular structures, toxicities, and growth. We fight with the virus. Although many people from 100 years ago to now, many people sacrificed, unfortunately. And this time, we have already known that COVID-19, this new virus, has the similar pathological features of SARS and MERS. Although this new coronavirus may be associated with more respiratory distress syndromes. According to the updated data on October the 9th, more than 30 million people were infected this year, with nearly 1 million deaths. We can see from the picture that the US has the most population in the world, and it seems the number of infected people is still increasing quickly. Here I want to show you 2 editorials. The left one is from the New England Journal of Medicine. Because of the leadership of vacuum, the United States instituted quarantine and isolation measures late and inconsistently, and they were incapable of testing effectively and couldn't provide even the most basic personal protective equipment to healthcare workers and the general public. And on the right, in the Lancet Infectious Disease, the author has praised Chinese control measures. Every people keep wearing masks, although there's only some new cases these days in China. And in Wuhan, we can't forget these 76 days from January the 23rd to April the 7th, when everything was quiet. And this is me, walking on the street home after a night shift from the hospital, with only some ambulances passing by. You can see everything is quiet here. And in those unforgettable days, more than 40,000 medics raced against the clock to assist Hubei province from all over China. They are all my colleagues in the China and Fangcang. The makeshift hospitals were rapidly set up in all the stadiums in Wuhan, so that patients with COVID-19 did not have to isolate at home, which reduced the risk of family members being infected. And these are two special hospitals called Leishanshan and Huoshenshan Hospital. And they are the emergency specialty field hospitals with 2,000 beds, which were named with gods in China fairy tales. They are built up in amazing 10 days. The workers give up their Chinese spring holiday, and worked around the clock for the projects in only 10 days. And in my hospital, Tongji Hospital, 6,200 staffs stopped their routine work for infected patients on 4,000 beds in 2 campuses, and in which 3,539 patients in critical conditions have been treated. 13 medical teams, you can see, including tracheotomy, incubation, throat swabbing, and so on. There are 13 medical teams were quickly established for the patients. Here, I show you some pictures. The first one is the tracheotomy and the incubation team. And this one is the continuous renal replacement therapy. And this is the ECMO. The patients were taken off. The nurses and doctors take off the ECMO from the patient. And my colleagues and I was in a throat swabbing team. We are heavily equipped. We do the throat swabbing the whole day in the hospital. This is my major work at that times. Another special team is for the newborn babies. This baby is called a little pomegranate, whose parents were both infected when she was born. And then she was taken care in Tongji, in my hospital, for 1 month after her parents were killed. And except for the work in the hospital, we also had online medical inquiries for those mild patients at home. And they didn't need to clean up in the clinics and to prevent and control the occurrence of the cross-infection effectively. I have taken about 500 inquiries, online medical inquiries in those days. And here are some details of how we did in those days. And first, we believe that life is the most important of all. We take the open, transparent, and responsible manner for the therapy and the prevention. And we use the science-based, legal, and targeted measures to treat each patient with a personalized plan. And we must thank the coordinated national response in this fighting. In China, we doctors and nurses, we are called the heroes in harm's way. That is, the reversers on the road of antivirus. However, I don't agree with the word reversers, because I think for doctors and nurses, for us, we have to stand on the first line to fight against the disease. And we have to face the difficulty and win this battle with our knowledge. I think it is our responsibility. For the second part, I want to talk about how we prevent and treat the COVID-19. Here, you can see there are 3 transmission ways for the virus. The first one is a direct transmission. Sneezing, coughing, droplets, and close breathing from patients can be transmitted. And the second one is aerosol transmission. That is, droplets with the air could infect a far distance. Although this way is not fully recognized by every experts. And aerosol transmission can be done in about 1 meter. And the third way is the contact transmission. Droplets deposited on the surface of the desk could be touched by others. And here is the study. According to the survey from 1,099 samples, patients with COVID-19 infections had a median incubation of 3 days, and the median age was 47 years old. And the most common symptoms are the fever and the cough. And we can see that although nearly half didn't have any symptoms at the early age. In January, Chinese experts have drafted a guideline for the diagnosing and treating COVID-19. We can see in this paper, suspected case and confirmed case are recognized. People with fever, imaging features of lung function, and normal or low white blood cell or low lymphocytes at the early stage, or they have travel or residency history or contact with patients 14 days before symptoms are the suspected case, and they should be isolated at home or in the hospital. And patients with positive respiratory or blood samples, nucleic acid tested by PCR, RT-PCR, were confirmed cases. And here are the CT scans. CT scan findings could be 3, and they could be ground glass opposites in the early stage, and consolidations after more fluid accumulate in the lobes of lungs. And some CT scans show a so-called creasing paving pattern due to the swelling of the interstitial space along the walls of the lobes of the lung. And this slide shows the CT scan of the progression of the infection. At the very early stage, we can see the ground glass opposites, and then the swelling of the interstitial space. We can see the creasing paving pattern, and then the consolidation. So generally, after 2 to 3 weeks or a longer time of the therapy, the lung lobes would return to the normal. And this guideline also gives some recommendation of the treatments. For the infectious patients, bed rest is important, and best supportive care is also needed, and supporting of nutrition and keeping water electrolyte balance, and monitoring vital signs including heart ratio and oxygen and respiratory ratio and blood pressure. The second is to examine the CBC and CRP, procalcitonin, PCT, liver and kidney functions, blood clotting function, ABG, and chest imaging. And for thirdly, effective oxygen therapy, including through nasal tube and mask, hyperflow nasal oxygen therapy, HFNO, non-invasive or invasive mechanical ventilation are for the critical condition patients. And we can use ECMO for the very important or very critical patients. And drug therapy may be chosen carefully, although there are no enough evidences from clinical trials. We can see that there are 4 parts. There are 4 categories for the drug. The first one is the so-called antivirus drugs. However, there's no data from RCT randomized clinical trials. From RCT, there's no data from RCT shows that special antivirus drugs are effective. So we can try the alpha interferon inhalation. And the second one is that antibacterial drugs. For most of the virus infections patients, they can be infectious by the bacteria together. And so to avoid inappropriate use of antibacterial drugs, and oral administration for community expected for pneumonia can be used. However, in some critical conditions, we use the antibacterial injection in the hospital. And for the third, glucocorticoids may be very important for those patients, and controversial with the GC glucocorticoids in respiratory distress disease symptoms, especially for injection use. And methylprednisolone could be used in severe patients or those with rapid progression. Others, we must know that the symptoms, how to control the fever, the stress ulcer, and so on, are very important, are very critical for these patients. And we should know some other symptoms like deep venous embolism. And we use Chinese traditional medicine for those patients to alleviate their symptoms, like the fever, the vomiting, or other fatigues, and so on. These are the drug therapy. To prevent the infections during the epidemic, the key issues, I think there are 2 key issues. They are washing hands and wearing masks. We can learn from the pictures how to do from those Chinese posters. And as an oncologist, I have paid much attention on the patients with cancer. And those articles show that cancer patients may be the high-risk group to be infected. The infection rate was higher than the overall cancer incidence, and higher than the incidence in the whole population. We can see in this paper from the Wuhan hospital, the OR is 2.331, especially in the aged patients. More than 60 years old, patients more than 60 years old has a high infection risk. And I also have concern about the positive cases after recovery from initial infection. After all, the re-positive rate could be 3%, and they maybe didn't have any symptoms. So, but they are infectious. We have not found any predictive or prognostic biomarkers for the COVID-19 until now. However, we indeed have many clues. The first one is the neutrophil to lymphocyte ratio, NLR. we can see in this paper that patients with less than 50 years old and NLR less than 3.13 may be the mildest. This subgroup may be the best group, and they could isolate at home per author's suggestion, although this is a small sample study. And the lymphocyte could also be used as separately as a biomarker. The less lymphocyte count, the more severe condition. We can see in the critical year, lymphocyte percent will be 5%, and they could be taken to the ICU for the treatment. The more lymphocyte percent is 20%, could be cured in this study. And the cytokines such as interleukin-6 and interferon are associated with NCP. And in mild group, most patients had normal values of interferon. You can see there are 90% interferon. While in severe group, more patients had the higher values of interleukin-6. Here, there are 76%. And similar findings could be seen in CD4 positive T cells and CD8 positive T cells. These cytokines from peripheral blood could be used to divide, to recognize from different aliases. And the last one is angiotensin converting enzyme 2, ACE2. And this one was found in the cancer patient some years ago. And we can see that in the CRC colorectal cancer, in this study, the result, the ACE2 were positive, have more positive patients in the CRC comparing to the healthy people. So these results may explain why cancer patients have more risk of infection. At last, I appreciate world help. I want to appreciate world help from the world. One world, one dream, and miles apart, but close at heart. Together we stand, my arms flying. A voulu, la voulu assez la force. I don't think if my pronunciation is good, is right. Okay, and here's the high-speed railway station near my home in Wuhan. Just like the train moving to the hope. I believe that the united strength will certainly take us to the extremely success. And that's all. Thank you very much.
Thank you, Dr. Chao. Thank you so much for your conference. It was a great experience sharing with us. And if you let me, there are some questions about it. So let me just say it in Spanish. Para quien desee hacer alguna pregunta adicional, tenemos el segmento de preguntas y respuestas en la barra inferior. Para que pueda participar. So, Dr. Shao, I'm going to start with the first question. Someone says, if the infection transmission has any influence in the severity of the symptoms?
I mean the influence, the common influence, right?
Yes, I think what she wanted to say is that the transmission has any, I mean, it has any more risk in the severity of the symptoms, the way of transmission of the virus, if it's an aerosol or is it by surface or something like that?
Yes, that's it. This is the I think I have shown the 3 ways for the transmission, right? So when the droplets are deposited on the things on the desk or on other things, books, desk, pens, they can be transmitted. So we need to pay more attention to this. So at last, I think wearing masks should be very important to avoid this touch. So this contact, okay, this contact and transmission.
Okay, and let me just do the other question. What is your experience with using plasma from previously infected patients in the new ones? Do you have any experience with that? Yes.
Yes. Yes, I have worked in the hospital in the hospital, and I have seen many effective patients for the COVID-19 these days.
Okay, I think that question wasn't very good understood. Did you use any special or specific treatment for the patient's recovery, like plasma or I don't know, any specific treatment did you use or you have experience with?
Treatment for the patient or for the recovery?
Yeah.
Okay. I think that after the treatment for the COVID-19, some patients still have the symptoms of cough or other chest pain or like that. So they need to use some drugs to control their symptoms. And still we can find that some people even have the fatigue or the like that, for some fatigue symptoms, or they don't have any sometimes I don't have any the sleep disorders like that. So I think these symptoms are maybe in fact associated with the recovery of this infectious. So we need to control them. But I think the drugs or the treatment for these symptoms are not very special. They are just the same treatment of the common for the infectious patient or non-infectious patient. And Chinese traditional medicine may also be useful. That can be used in China. Okay.
Okay. So countries like Spain or France are right now in a second lockdown. So why didn't this happen in China? What do you do in China to prevent this a new lockdown?
Okay, I think this is a very good question. You can read the news for the last week that we can see some new cases in Qingdao in the Shandong province in the hospital, but we didn't lock down the whole city because the Qingdao city do the swabbing, do the test for the whole patient. So they can say, and they do the, I think that they do 8 million patients in just 3 days, and without any new cases in this healthy population. So I think they maybe this is one reason for not a lockdown in the city, because there's no new cases in the community, in the street, only in the hospital. Okay.
Okay. So another question is, how soon do you think we can expect an effective vaccine for the virus?
I think, according to news and experts, there will be 1 year, and we should know in the winter or in the autumn, this infections will be another. There will be another infections in the whole city. So we should take this importantly. And I think another important thing is the vaccines. So in China, there are about 7 companies who study and do with the vaccines. So after the vaccines can be used for the whole city, I think the whole infections could be done, and could be we can't be more worried about the infections. Maybe 1 year later.
1 year. Okay. So thank you, Doctor. Another question is, how is China right now? Is everyone still wearing masks?
Pardon?
Yeah. Someone asked, how is China right now? So is everyone still wearing masks? Do you still using all the protective measures?
Yeah, every Chinese, especially in Wuhan, because we know that that's the first city in China. So in Wuhan city now, we can see every patient, every people in the streets, in the hospital, in the companies, wearing masks everywhere for everyone. So they are important. And this is very important here.
Okay, thank you. So is there any relation between the blood type and how susceptible you are to the infection?
Blood type?
Yeah, blood type. The blood type. Is there any relationship between the blood type and how susceptible you are to the infection?
Yes, I think there is. Yeah.
Okay. So why do you think there are less new cases in China than in Europe?
So I think it's more important to prevent than to treat. Okay, the prevention is more important here. So washing hands and wearing masks can be very, very important for the whole patient, for the whole people in the world. We can control our symptoms, or we can control our the virus for some patients in one mask to not to transmit it to everywhere. So this is the more important one. For us, I can say that some people, but in China, also in China, some people don't take this seriously. So others will say to him, "Hey, wear masks." Some people will say to them in the street or in the hospital. So it's very important. I think after this infection, after this the COVID-19 infections, every people know the importance to wearing masks, especially although maybe some years later there's no infections in the world, they can wash their hands and wearing masks in the crowd, in the patient, in the hospital, like that.
Okay, thank you. So you were one of the first hospitals to have COVID cases. So how about the immunity acquired by those first patients? Is it last?
I think your question is about the immunity for the virus, right?
Yeah, the immunity acquired by those first patients. Is the immunity last enough?
Yes. Some people, we can see the test report. Some people, after the infections for the COVID-19, they can have the IgM positive antibody positive, and or IgG positive, antibody positive. So they can be last for many months. Just like the, I don't say if this is right. I think this IgG positive, antibody positive, just like the vaccines for these people, and can be last maybe for many months.
Okay. There has been some research about remdesivir as an effective drug for COVID-19. So what do you think about this? What your experience with remdesivir?
For the research for the COVID-19?
Yeah, COVID-19, about the effective use of remdesivir as an optional drug.
Okay, there's no RCT data for this in China, but including in my hospital, just like the remdesivir, okay, just like that antivirus drugs are not commonly, are not regularly used. We can see the for especially for critical conditions, people with critical conditions, the most important is for to use the glucocorticoids, is to use the oxygen therapy, just like that, to control the organ function, especially for the liver, for the kidney function, for that. And they have compelled for to just use the antivirus or not use the antivirus. They compelled the two subgroups that the whole days, the whole time to recover from the initial therapy are nearly the same. So and if you use the antivirus drugs, there will be more symptoms from the drug, like the diarrhea, just like that, white blood count, the loss, or just like that. So we don't use these antivirus drugs regularly.
Okay, so based in your experience, is there any recommendation you have for the population or for the healthcare workers in Mexico right now?
Yes, and I have to say very many times that washing hands and wearing masks are very, very important, because every patient, every people have the the immunity for the antivirus. We will not be regularly go to the critical one. So many people, especially although they were infected, they are the mild condition. So we can recover from the infections. So from that, just some small, some simple drugs or bed rest, like that. So if we don't wear masks or washing hands, we will take more virus on our body. so there will be more severe. There will be more severe for the patient for us. So wearing masks and washing hands is very important for everyone. That's for them. Not only in China. I think this is very important for the whole world, for Mexico. Okay.
Okay. What is the experience you get when you reopened the city, when you started again opening schools, universities? What was the experience you have there? There was a second wave of infection. Were there any more risk when you opened the schools?
For the more schools.
Yeah, when you open it, the city, when you started to open the schools of the universities, were there any more risk, or there were any second wave or any other more cases?
Oh, in fact, we have many trainings and many school lessons for this COVID-19 in our university, in our hospital. For every student and for our every staffs in the hospital, we must know how to prevent and how to treat only for the COVID-19 infections. I think this is important, especially for the medical students.
Did you change anything in how you teach medicine to the students in the universities?
Change the medicine, change the drugs for the antivirus, COVID-19.
Yes, there were any changes in the way in the methods?
No, I think they are the same. I think they are the same because we have the we have a word called the 统计 patterns. Just like that, we have conclude from those days, from the 60 days of the lockdown. So we have the we have the patterns, 统计 patterns to how to treat. We follow these patterns to prevent, to recognize every patient. So maybe there will be new data from the RCT, from the new trials, clinical trials. So we can change. So that, but I think the prevent, not for the COVID-19, for the flus, for the common flus, maybe just the similar.
Okay, thank you. There's a few questions about contact transmission. How effective is it really, this kind of transmission about contact? I mean, the surfaces or something like that?
Yes, called contact transmission. Maybe you don't think it is. Maybe you think it will be not transmitted just on the just like on the doors, on the pen, on the book, on the desk, but it is just like that. So we do the cleaning for those things, for the door, for the desk, for those every day in the hospital, in the company, like that. So maybe the droplets will fly. I think maybe it's like that. The droplets will fly from the door, from the desk, and will be inhaled to you by you. So I think they are it is the way to transmission we found in China.
Okay, so how can you help us understand, please explain the differences in the mortality rates between healthcare personnel? I mean, the differences in the experience setting in Wuhan and why is that that mortality ratings are very increased in Mexico in the Mexican healthcare workers? What do you think you learned in the first phases of the pandemic situation?
Yeah, the pandemic situation. I think that we have experienced a pandemic situation in China, in Wuhan, and then in other parts of the world. It will have another one. I think it will have another one if we don't take much care about it. But I think if the vaccines have been studied, have been used for the whole people, this risk of pan-epidemic will be more low down.
But what about the healthcare workers, the mortality in the healthcare workers? What was your experience there?
The healthcare workers?
Yeah. How did you manage the risk of the healthcare workers?
Yeah. In fact, you can see from my slides that there were 40,000 medic staffs from the whole China to assist Wuhan. But you maybe don't know that there's no infections for this assistance for those staffs. So I think the so-called in-hospital infection management may be very, very important. Every staffs in the hospital for the healthcare workers, or in the community for the health workers, is very important. They should use their the basic prevention or basic control management. And I want to say that I can see the news from television that even in China or in other parts of the world, in the hospital, many workers, many healthcare workers, many doctors didn't wear their masks or wear their clothes didn't wear properly. So the neck or the eyes were exposed to the air. So that's very dangerous. So we must take more care for those details.
Okay, thank you, Doctor. I just write in the chat one of the questions for you about the recommendations. Okay, so Doctor, is there any other recommendation you can give for the healthcare workers to prevent complication of the infections?
Yes, for the healthcare workers, I think they are the more important for the patients. They can't be infection. They can't be infected. Okay, and you mean the complaints?
No, I mean risks about getting infected.
Oh yes, that is the same. That is the same suggestion. That is, we wash our hands many times in the hospital here, and take our masks and change our masks for every 4 hours. That's important. You should everyone should follow this management for those rules.
Okay. Well, there's a lot of questions about the vaccine and vaccines and transmission. I think you already covered that in your explanations. Somebody asked if there is something special doing right now in Wuhan to prevent any new wave of infections. Is there any measures or politics you apply in Wuhan?
Yes, in Wuhan or in the whole China, we go to the trip, we have to take the travel. Everyone has a so-called a code, a QR code in the smartphone. They have to show that and scan the code. Even everywhere, you can the staffs will scan your code to show to validate if you are from the risk areas or the safe areas. I think after this the epidemic in China, this management for the public areas change to very common things.
Okay, thank you, Doctor. So we're getting close to 8 p.m. right here in Mexico. So I think, well, I think that was the last question. So thank you very much, Dr. Chao.
Thank you.
I'm gonna let, it was a great conference. So I'm gonna let Dr. Marta to continue. Thank you very much, Dr. Chao.
Okay, thank you.
Muchas gracias. A nombre de la UDEM, de la Universidad de Monterrey, agradecemos al doctor Xin Shao por su contribución en este tema que nos ayuda a conocer más acerca del país asiático. Y como reconocimiento a su participación, hacemos entrega del presente diploma virtual al doctor Xin Shao por su aportación a este evento. Gracias. Muchas gracias. A continuación, les agradeceríamos emitan su opinión llenando la evaluación electrónica de este evento a través de la plataforma Shred, la cual se toma en cuenta para mejorar la organización del mismo. Esperamos que este día siga siendo provechoso para todos ustedes y les invitamos a seguir participando en el resto de las actividades de la Feria Internacional UDEM. Les recuerdo a nuestros alumnos que en el chat se les compartirá la liga para su certificado de asistencia. Muchas gracias a todos.
Muchas gracias a todos por acompañarnos.